Okay. So right now I'll be teaching about immunology. Uh, so first thing, what is immunology? Immunology is the study of specific resistance to a further infection by a particular microorganism or its product. So the resistance is actually produced by the body against a particular. It may be a particular microorganism, or it may be the product of the microorganism, or it may be some dust particles or allergens. So the science which deals with the body's response to antigenic challenge. The immunological mechanisms is protects immunological mechanism helps in protecting the body against the foreign infectious agents. But there's one bad thing about the immunology is that it can also cause damage to the host immune body also. That is what we call as autoimmunity.
Autoimmunity.
Yeah. So what is where do you apply the immunology topic and the knowledge about immunology? Where do you apply? So it helps in understanding the etiology and the pathogenesis of the disease. So the disease where is very useful is like rheumatic fever, it's autoimmune disease, systemic lupus, erythematosus, then the bronchial asthma. It's all mainly due to immunological reactions. Then next is it helps in the diagnosis of the disease also. So the diagnosis, what test which we do in diagnosis of the disease is the ELISA. ELISA is enzyme-linked immunosorbent assay. That we all know that. So
Yes,
it
sir.
helps. This laboratory test helps in diagnosing the disease. Then immunology, where we apply immunology, is in the development of vaccine. Most of the vaccines are either live attenuated vaccine, or it may be dead vaccine, or it also helps in treatment using antibodies. That the antibodies are mainly immunoglobulins. Then this immunology also helps in transplantation and blood transfusion. So transplantation medicine, we will actually screen for any immune reactions. Then only we help do the kidney transplant or the lung transplant. Then in blood transfusion also we do screening. Then immune surveillance immunology is applied. Then identify future susceptibility of a person to a disease with the help of HLA typing. There's a thalassemia screening, then HLA typing. Then you find out whether there is any disease like osteogenesis imperfecta. So it helps in screening also. So what is the
Yes.
definition of immunity? Immunity is the resistance exhibited by the host against infection or other foreign substance. You have seen this already. So immunity is mainly divided into innate and acquired. Innate means natural, or it is got from within, like a hereditary type. And acquired is actually got once we are exposed to other immunitical agents, then we acquire that immunity. So the innate immunity is maybe again divided into individual. It depends on the individuals. It depends on the race. Race includes African, Caucasians, Mediterraneans. Then it depends on species also, like humans, then animals, different type of animals, species, plants, or this innate immunity is further divided into individual racial species, whereas acquired immunity is divided into active and passive immunity. Active is again further divided into natural and artificial, and passive also is divided into natural and artificial immunity. So what is natural, what is artificial, and what is active and passive will come again in the I'll explain detail in each and every slide. So what's the two major difference between the innate and the adaptive? So I told you whatever it is. Innate means it is coming from within, or we got from the starting itself.
Right.
Adaptive is actually we are got from the secondary response, or we are adapting, our body is getting adapted to this immunity.
Yes.
So innate immunity is from birth, whereas adaptive or acquired immunity is acquired during the course of life. In innate immunity, since it's got from birth, we don't need any prior sensitization to antigen is not required. Whereas adaptive immunity, we need prior sensitization, because you need to get exposed to that. Then only that immunity will be developed within us. Then next is memory. Memory is absent in innate immunity, whereas memory is present in adaptive immunity. So this memory will help in, like if we get again exposed to the antigen, the antibody will react more fast. So I'll tell you the mechanism again in the further slide. Whereas in innate immunity, the secondary immune response is same. So when the first time how the immune response is, same way the immune response will be during the second exposure also. But in adaptive immunity, since memory cells are present, the secondary immunity will be much faster than the primary exposure. Whereas in innate immunity, the receptors mostly are mainly pattern recognition receptors and toll-like receptors. These receptors I'll give little details in the further. Whereas in adaptive immunity, the receptors are mainly T and B cells. These are the two main immunity acquired immunity cells. So you have to remember T cells and the B cells. Whereas in innate immunity, you see like a non-specific type of action is seen. That's directed. This immunity is directed against any microbial agent. So whichever microbial agents attack, the type of immune response will be the same. There won't be any change. And you can bind to any microbial surface molecule. Whereas in adaptive immunity, it is directed against a specific microbial antigen. That is directed. It might be directed against the antigens produced by the T cells or B cells. May be directed when it's exposed to only streptococcal antigen. So if again once more streptococcal antigen or particular staphylococcal antigen is exposed again, then only the immunity will react. Otherwise, if for streptococcal antigen won't react with the staphylococcal antigen, like it. And it is specific epitome of antigen is present. Epitome means it is actually the a receptor over an antigen where the antibody binds. That is the epitome.
Epitome. Yes.
Yeah. Then spectrum is very narrow for innate immunity because even though it acts widely against any microbial antigen, but the spectrum for it might be act only staphylococcus, streptococcus, or a small test group of antigens, but the adaptive acquired immunity can act against various type of antigens. There is no like a particular small type of group of antigens. No, it can act on where it can act on HIV, Ebola, then coronavirus, like it acts.
Yes.
So you got the difference between innate and adaptive immunity, right?
Yes, sir.
Oh,
Yes, sir.
any doubt on this?
No, till now, no, sir.
Okay, fine. So next is what are the components? You don't need to remember each and everything. Just I'm just gonna tell just phagocytes. There's a neutrophils, basophils, eosinophils, macrophages. These things you come in mouth during the sleep also. The next is complement is the alternate and mannose binding pathway. I'll come to in the complement chapter. The normal flora of the gut, the skin and mucosal barrier. These are all innate. It's present since birth or it's grown within the fetus. Then the fever and the inflammatory barriers. Then the NK cells. Just remember, NK cells are natural killer cells. Then the mast dendritic cells and acute phase reactant proteins. These three things you must remember. The NK cells, the acute phase reactant proteins, mast and the dendritic cells. These are innate immunities. They might ask you in multiple choice questions. Out of the following cells which are innate immunity cells, they might most commonly ask NK cells, acute phase reactant proteins, mast and dendritic cells, and macrophages. These four cells. Whereas components of the acquired immunity includes the T cells, B cells, the classical complement pathway, not the alternative. See, complement pathway, alternative, and the mannose binding pathway is innate immunity, whereas the classical complement pathway. Do you remember two C's? Two C's is the part of innate, acquired immunity. Classical complement pathway, it is, and just mnemonics. If you're easy to remember the mnemonics, then you remember. So that you might not get confused between these two options. So always remember two C's are acquired immunity. So classical complement pathway is acquired immunity. Then next is cytokines. It includes the interleukins 2, 4, 5 and the interferons gamma. These are the components of the acquired immunity. So acquired immunity includes T and B cells that we should know properly. Let's not forget that. Then the classical complement pathway. Then cytokines, which includes the interleukins 2, 4, 5 and the interferon gamma.
Interferon gamma.
Yeah. So now what is I'll tell in detail about each and every immunity properly. So the innate immunity, the basic immunity which may be genetically passed on from one generation to the other generation. Then it doesn't depend on the prior contact. It's divided into species immunity, racial immunity, and individual immunity. I didn't go in detail of these things because these are just basic things. If you want, you can just read. You follow which textbook?
Apurva Shastri.
Apurva. So in that they have given a small notes. You can see that notes. Nobody's going to ask questions on these things. So you can just, it also doesn't matter. Then as I told about pattern recognition receptors, this is a bit important. They might ask, what is pattern recognition receptors? These are molecules present on the surface of host cells that recognize the microbe-associated molecular pattern. So these are present on the host cell surface and they recognize the microbe-associated molecular pattern. So these are the patterns which are present on the antigen, microbe-associated molecular patterns. They are conserved regions encoded by germline genes, because you know what are germline genes? They are the genes which are present since birth. So during the embryology time itself, these are present. So they are conserved regions encoded by the germline genes. The classical example is toll-like receptors. You know why they are called toll-like receptors? Because these same receptors are present in a fly. That is the Drosophila melanogaster. You know what is Drosophila melanogaster? This is scientific name, Drosophila melanogaster. That is actually the fruit fly. Fruit fly or the Kannicha.
Okay.
Yeah, that is it. So these receptors are present in the same like receptors are present in Drosophila melanogaster. So this called as toll-like receptors. So they on binding with the microbe-associated molecular pattern, they activate the transcription factors that stimulate expression of genes encoding cytokines and enzymes. So these toll-like receptors, when they bind with the microbe-associated molecular pattern, they causes the synthesis of the cytokines and enzymes. This is a basic. This is a simpler language which I told you. Understood?
Yes. Yes.
Yeah. So it's involved these cytokines and enzymes then involved in several antimicrobial activities of the cells of the innate immunity. So you got it right. What is pattern recognition receptors?
Yes.
Yeah. Oh. So next is phagocytes. That's what I told you about macrophages, neutrophils, basophils, monocytes. All this. In this is actually the component of innate immunity rapidly recruited at the site of infection. It includes neutrophils, macrophages, which are including monocytes. So now how the phagocytosis takes place. It includes mainly the three sequential steps. First, there will be engulfment of the macrophage. That is, the microbe will swallow this. The phagocytes will swallow this microbe. Then, after they swallow, they form a small bag-like thing called the phagosome formation. So these phagosomes, then they'll fuse with the lysosome because lysosome will contain the lytic enzyme. So you know that word itself, lysosome,
Like
the breakdown of the organism. So they contain the lytic enzyme, and when this phagosome combines with the lysosome, they form the phagolysosome. And once phagolysosomes are formed, the microbes, the lytic enzymes will enter into the phagolysosome, and they will kill the microbes. So that finally the microbes will be killed. So you got it right, phagocytosis.
yes.
Oh. So next is NK cells. What are NK cells? They are found in innate immunity. They are called natural killer cells. Then it's a class of lymphocytes. They kill virus infected cells and tumor cells also. So this one actually NK cells, they don't kill actually the antigen directly. It kills the cells which contains the antigen.
Okay.
Got it? So once the cell contains viruses or it might be a tumor cells, which is different than the normal cells, and these NK cells will go and kill the cells. But if any virus is present in the blood, it won't kill the virus. Only the cells it kills. So you should remember that.
Yes.
Okay. Then next is dendritic cells. Dendritic cells, again, is a part of innate immunity. It produces numerous cytokines that initiate inflammation in response to microbes. Here, they kill the microbes by causing an inflammatory reaction. So it directly doesn't kill the microbes. It creates an inflammatory reaction, and this inflammatory reaction will help in killing the microbes. And one more thing is that it serves as a vehicle to transport the antigen from the skin or mucosal surface. So the antigen from the skin or mucosal surface is carried by the dendritic cells to the lymph node. So in the lymph node, they are present the antigen to the T cells. So T cells is actually a part of the acquired immunity, and dendritic cells is part of the innate immunity. And the mucosal surface also is a part of the innate immunity. So these dendritic cells, they act as a barrier. So they act as a transporter or a connector between the innate immunity is what? It is the skin and the mucosal surface, and T cells are the acquired immunity. And these dendritic cells takes the antigen from the innate immunity and it presents to the acquired immunity. Therefore, it acts as a bridge.
Yes.
Got it?
Yes.
Okay. So next is now I'm going to tell about, now we have done with the innate immunity. Now I'm coming about acquired immunity. So in acquired immunity, there is actually two types, natural and artificial immunity, or actually active and passive immunity. And active and passive immunity is divided into natural and artificial immunity. So what is called active immunity? Active immunity is that the host immune response is actively involved. That's why it's called active immunity. And it is why it is how do you explain why it's called how is host actively involved? Because here in natural immunity, the infection, you're exposed to the infection and then the immunity is produced. So it's called natural active immunity. Whereas in artificial immunity, example is vaccination. vaccination is what? Live or dead virus,
Good.
virus
Yes.
or bacteria. So these are actually again exposed to the virus agent, viral agent. So the bacterial agent is again an antigen, but it is not like naturally exposed. You are giving an artificial exposure. That's why it's called artificial, but the host active immunity is involved, so it's called artificial active immunity. So you got it right.
Yes, sir.
Okay, fine. So there's acquired immunity. The subdivision is active immunity, and it is divided into natural and artificial immunity.
Natural and
Natural
artificial.
is following infection, whereas artificial because it is due to the exposure to the once it's developed once exposed to the vaccination.
Yes.
So the next is passive immunity. This here no, then why it's called passive immunity because the host immunity is not involved. We're not letting it to produce immunoglobulins but we are giving immunoglobulins from outside. So one form is natural form is that you're getting antibodies from the mother, that is at fetus time. So that is mainly immunoglobulin IgG or IgM. IgG mainly actually. If you have IgM, then it is mainly actually due to exposure to virus. Then second type of passive immunity is the artificial. That is you give immunoglobulins. That is Ig immunoglobulins are injected. That is rituximab, monoclonal antibodies, all those things. So here no, the body is not producing immunity. Here we are giving immunoglobulins from the outside. That's why it's called passive immunity. So
Artificial.
understood between the active immunity and the passive immunity of the acquired immunity.
Yes.
Got it right?
Yes.
Oh. So now what is active immunity? Resistance developed by an individual towards an antigen stimulus. Antigen stimulus. Host immune system is actively involved. It leads to production of immunologically active T and B cells and specific antibodies. But this active immunity is failed to see in the immunocompromised host. Because in immunocompromised host, there is no active actively producing immune system to these cells, T cells and the B cells. Now I told right about the immune response, how the memory cells and how the first phase of the immunity will be there. I'll explain right now. So the type of
Yes.
immune response vary depending on the microbial exposure that occurs for the first time. That's when the first time when his person is exposed to the virus or the antigen, that response is called the primary immune response. And again, the same person at the subsequent time is exposed to the antigen, that is called the second immune response. So this is a graph of it. I'll come to it later because I'll step by step I will explain to you.
Yes.
The primary immune response on antigenic exposure following events takes place. So at first when the person is exposed to the antigen for primary immune response, these are the events which takes place. So there is a first phase called the latent or the lag phase. Why it is called the lag phase? Lag means there's a delay. Time required for the host immune apparatus to become active because once the antigen is when the person is exposed to antigen, the antigen should sensitize the immune system of our body and it will produce T and B cells. So the T and B cells will get stimulated, and once it gets stimulated, it takes some time to produce the antibodies. So once the antibodies produced, in that 95% will produce to exponential or the log phase. Exponential phase means it is gonna produce a large number of antibodies, so that you find a rise in the number of antibodies as an exponential or the log phase. But 5% will become memory cells, and these memory cells is the one which will help in the subsequent exposure of the
Secondary.
secondary. That's the secondary immune response. Yeah. So in the log phase, there's the exponential phase. The effector B cell produced antibodies, mainly the IgM type. So I told you right, acute during the acute attack of the IgM, immunoglobulins, which IgM comes first is the IgM.
Yeah.
Yeah. So you remember why you understood why I told acutely is IgM. Or chronically when you test a person, you will find IgG. I'll come to that again. I'll come in. So it reaches so the IgM, the immunoglobulins or the antibodies, it reaches peak and maintains the level for the some time. So that is why it's called exponential phase and log phase, and then it will fall down. When it falls down, I'll tell you why it falls down. Finally, at low titer of baseline antibodies may be maintained in the serum. So first there will be lag phase, then there will be exponential and log phase. Then there will be a fall in the number of antibodies. Why there is a fall in antibodies? Because these antibodies will form an antigen antibody complex. because they'll be
Complex.
finding a war, and then the number of free antibodies level will fall down, and there'll be low titer of baseline antibodies will be maintained in the serum. So now now you understood. See in the I'll show you the graph actually. See there's a lag phase. There's a in the primary antigenic immune response. There's a lag phase. There's a first there'll be a small straight line, low baseline. That is the time where the body is getting sensitized to the antigen, and T and B cells are produced. 95% will be the normal
IgA.
antibody. 5% will be the memory cells. So then there'll be a log and exponential phase, which is a rise in titer, and then it's a log phase as the IgM titer will be there. It will raise above, then it will stand there itself. It won't raise above that.
Yes.
So there,
Yes.
because it will be making an antigen antibody complex. Then the number of antibodies will be decreased. Free antibodies will be decreased. That you find as dropping low titer phase.
Yes.
So you got the primary immune response up to the negative phase. It is the primary immune response.
Responses.
Yeah, you can see the graph, right?
Yes, I can see.
Yeah, you're able to see my PPT, right? Have you got
Yes,
a,
sir.
have you got a PDF before my class?
No, sir, I haven't
Okay,
received.
I'll share it to them, and I'll tell them to send it to you. I think so. They might have misplaced it because I've been taking class, right? I thought they had my PDF. It's okay. I'll just send them again, so that you'll get it. Actually, you can during the exam time also you can just read my PDF, because I'm just point to point, which for the exam, mainly for the exam oriented I'm teaching. So you can
Yes.
when you're writing exam, right? Don't write blah blah blah. Just write point to point. They'll be happy and they'll give you marks. If you write
Yes.
sometimes blah blah blah, right, they might get angry and they will deduct your marks.
Yes.
Okay. Now we'll come to secondary immune response. When the same, so now I told you secondary immune response is due to the memory cells, and the memory cells which mainly acts. So when the same antigenic exposure occurs, the events takes place as follows. There'll be a lag period, but the lag period will be very short, or sometimes there won't be a lag period, because sensitized antibodies are the memory antibody, and this will suddenly come into action and start attacking the antigen. So there will be
Yes.
absent or short duration of lag period for memory cells to get active soon after the antigenic exposure will be there. And as soon as there is a lag phase, right, at the end of the lag phase, there will be a dip in the curve. That is the causative phase. And this dip actually is due to the antibody level, which is the number of memory cells antibodies present, will decrease, because they'll form an antigen-antibody complex.
Com-
So the level become lower than it was before antigen plus, because the exposed antigen combines with the pre-existing antibody, just causing a dip in the antibody. That is the negative phase.
Okay.
So you understood what lag period and negative phase in the secondary immune response.
Oh, so basically the
Got it?
pre-existing antibodies from the primary immune response, yeah?
Yeah, there is I told the 5% memory antibodies are there, right? They'll be
Yes.
present constantly towards the blood, in the serum. So once you again get re-exposed same antigen, this antigen antibody will suddenly attack them, this antibody, and they form an antigen antibody complex. So there will be a dip in the number of free antibodies, free memory antibodies. That will cause the negative phase. Got it?
Yes, sir.
Okay. So next is antibody search. Antibody. So now the body is again stimulated. Again the T cells and B cells are sensitized. No, the memory B cells, the memory antibodies are done its action. So now the T B cells and T cells got the time to produce antibody, and they produce enough number of antibodies, so much antibodies that you'll find an antibody search. Again, you'll find an exponential phase. That's a secondary antibody response is prompt, powerful, and long lasting. So now the secondary response is mainly, it is a chronic type of period you tell. So mainly of IgG type. So I told chronically secondary response or chronic time, it is IgG mainly. So IgG type is seen. Just the booster dose. So now where this secondary immune response is applicable is the booster dose of vaccines are more effective than the first dose. So example is COVID vaccine. Why they're stressing on that the second dose of vaccine or the third dose of vaccination should be taken, because mainly the when you again sensitize your body for the secondary immune response, so your body is getting more antibody sensitized, and there's a more memory antibodies present in the body, and this is helping fighting off the virus.
Virus.
So you know got the basic principle why booster doses of vaccination is needed.
Yes, sir.
Yeah. Okay. Now next we'll come to passive immunity. So now till now I was talking about active immunity. So now
Yes.
we'll talk about passive immunity. So passive immunity is immunoglobulins received passively. Here immunoglobulins are given from outside. So what is the problem? It lasts for only for a short time because the body is not sensitized. The body is not producing again once the immunoglobulin stores are like the antibody stores are completed. So then again they don't body doesn't produce. You have to put from outside. So it lasts for short time only. And secondly, there is thirdly there is no lag period, and there is no memory because our body is not exposed to the antigen. It's the immunoglobulins which acts against this antigen, and there is no negative phase. Subsequent doses are less effective. So if we keep on giving immunoglobulins, there's no use because once again immunoglobulin you're giving, again the body won't get will get adapted to it. It won't show so much effect like the first exposure.
Yes.
So, but these immunoglobulins are useful in few patients, like immunodeficient patients, who is the people who are not able to synthesize, they don't produce their own immune response. They'll have, for them it is very useful. Then it's you see it provide fetal immunity during the first days of the neonatal life and the fetal life. These immunoglobulins provide a greater protection to them, and the post-exposure prophylaxis. So like if you have a needle stick injury or HIV or hepatitis B needle stick injury, but mainly hepatitis B, there's a immunoglobulin treatment for that, so that we don't get hepatitis B. So those things it is useful. Or in the any other like rabies exposure prophylaxis also, but mainly rabies is actually toxins, not the immunoglobulin.
Yes.
Okay. So now I told about acute phase reactants. Acute phase reactants are again innate immunity. It's a but you see find a lot of things. Like, have you attended medicine posting?
Yes, sir.
Have you seen the lab reports?
No, sir. We had it online, so we haven't been
Okay,
there.
online. So when you go to medicine posting, take the patient's lab reports page and see simply what all lab report, what all tests they do. So when they do the test, no, there is especially with an infective patient or a pediatric patient having fever or any infection, they do a test called CRP, as a C-reactive protein.
C-reactive protein.
That test is actually a test for inflammation or infection. So if it's very high, it shows that the antibiotic response is not very good, and the patient is having high dose of infection. And if it's low, it is the antibody is responding and the patient's infection is coming down. So mainly the C-reactive protein theory it comes in microbiology also. That is they are the acute phase reactant proteins. They are the proteins synthesized by the other proteins. Then it's against acute inflammation. That is infective, or maybe it's seen in acute inflammation, or it is seen in infective stage also. So it's seen two main stage: acute inflammation or infective. So in acute inflammation, like in rheumatic arthritis or the MI, and it's seen in non-infective cases also. There are two types of acute phase reactant proteins. There's a positive acute phase reactant protein and the negative acute phase reactant protein. You know why they are called positive and negative? I'll tell you in the subsequent slide. So what are positive acute phase reactant proteins? They're called positive because the level increases during the acute inflammation. So during an acute inflammation, these acute phase reactant proteins level increases. That is, examples of acute phase reactant proteins, positive acute phase reactant proteins are C-reactive protein, serum amyloid A, mannose binding protein, complement factors like C1, C9, metal binding protein, coagulation factors like fibrinogen, von Willebrand factor. So in this main, you have to know is CRP, that is a C-reactive protein, the mannose binding protein, then the coagulation factors fibrinogen and the von Willebrand factor, and the complement factors like C1 and C9. Metal binding protein and serum amyloid we not so much use it actually. So CRP is important. Mannose binding protein is the most important. These two are the most important. Complement factors like C1 and C9 might see coagulation factors like fibrinogen and von Willebrand factor. These things we won't see, but they might ask you in the multiple choice question.
Yes.